Okay, Dan, so if you just face towards me, so the first thing I'm going to do is just look for any asymmetry from the front, looking at overall muscle bulk. Doesn't seem to be any wasting of any of the muscles I can see from the front. Certainly no deformity of the pectoral muscles. No sign of what we call a Popeye sign if a long head of biceps has been damaged. Moving up around the sort of the neck and shoulders, the trapezii look equal. No sign of a step deformity over the acromioclavicular joints. If you could just face towards that direction for me. So again, looking from the side, patients have got a good overall posture. Not really any protraction of the scapulae or the cervical spine. Yeah, looks good. Face that way. Thank you. Looking from the back, in particular, looking for any wasting of the spinati in this position. So supraspinatus and infraspinatus both look to have good bulk and quite symmetrical. A little bit more bulk of the left trapezius, actually, looking at it from the back. Okay, and just face back towards me. Okay, Dan, the next part of the examination, I'm just going to feel the shoulders. I'm going to be feeling for any heat, any signs of any tenderness on palpation when I press, and I just want you to tell me if it hurts. Okay. Also looking for any deformity, and the last thing I'll feel is stiffness, and look at what we call the accessory movements, which I'll be moving the joints a little bit for that. Okay. Okay. So just using the back of the hand to palpate across the shoulders. Not generally going to find any heat, but it's certainly part of a complete examination. Okay, and now I'm going to palpate what we call your sternoclavicular joints. So starting on the left. Any tenderness there? No. And then the right. Okay, so just working away laterally across the clavicle, feeling for any deformity which might reveal a previous fracture. Can't feel anything there. If I just come behind so we can see. So just pressing on the acromioclavicular joint. Any pain there? Any tenderness on that side? No. Good. Okay, good. So working our way down from the AC joints, what we're going to do is we're going to palpate the spine of the scapula and just come around to the back, which I'll stand behind to do. So first of all on the left asymptomatic shoulder, running away along the spine of the scapula, down the vertebral border to the inferior angle. Around here, just feeling for any spasm in the periscapular muscles. Okay, in this position it's also a really nice place to palpate the glenohumeral joint. So again, just checking the left side first. And just get my thumb underneath the acromion process a little bit there. And then gripping onto the head of the humerus, I'm just going to do what we call load and shift test, just to feel for any obvious laxity. And that feels good. Also in this position, it's a nice place to do what we call a sulcus sign, which is just looking for multi-directional instability. So if you just relax your arm for us there, and if I palpate the posterior angle of the acromion, just apply downward traction on the humerus, and we're looking for a sulcus appearing, which there isn't. So the same on this side. So load and shift test. And then a sulcus sign. That looks good. Any pain as I did any of those procedures? No. Okay, so I'm going to move on. I'm actually going to palpate the rotator cuff attachments, and I'll just talk a little bit about the anatomy as we're doing that. Okay, so I'm just going to move on to palpating the tendons around the shoulder, starting at the front and working my way around to the back. So if you just relax your arm down for us there. So the first thing to do is to orientate ourselves, and for that we use the lateral epicondyle of the elbow and work straight up, which will bring us onto the greater tuberosity of the shoulder. Now if we work anteriorly to the greater tuberosity, We'll slip into the intertubercular groove of the shoulder, up onto the lesser tuberosity, and just between the two, I can just run my thumbs down the bicipital tendon, which is the long head of biceps. Any tenderness in there, Dan? Good. And then we'll move around to subscapularis tendon. So subscapularis, if we work anteriorly to the lesser tuberosity and then just move medially, is the first structure that we hit. I feel okay there?
Yeah.
So that's a nice broad tendon. Rarely has any pathology, but occasionally we see tears in the upper part of the tendon. And then onto a symptomatic shoulder. So again, just relaxing the arm down, working up from the lateral epicondyle, move anterior, intertubercular groove or bicipital groove of the shoulder. Any tenderness? Sure. Good. Next thing round is the lesser tuberosity, into which the subscapularis tendon attaches. So subscapularis innervated by the superior and inferior subscapular nerves, and all of the muscles around the shoulder are C5 and 6. So if we palpate the back of the shoulder now, so I'm just going to actually move the camera a little bit so we can get a better view. Sure. So again, just palpating the rotator cuff from the posterior aspect. To get onto to supraspinatus, the best position is, if you're comfortable to do it, is to pop the hand behind the back. So on the asymptomatic arm, if you just bring that behind there, I'm just going to support the arm there. Find the anterior tip of the acromion process, drop down, and you can feel supraspinatus tendon and the greater tuberosity. So supraspinatus innervated by the suprascapular nerve C5 and 6. Any tenderness on that side, Dan?
No.
Good. Same on this side. Okay, alright. Is that a bit uncomfortable getting that position?
Yeah.
Okay, so anterior tip of acromion. What does that feel like?
Yeah, it's a bit tender.
A bit tender there, okay. And then just palpating directly on the tip of the greater tuberosity. What's that feel like there?
It's quite painful.
It's quite painful. Okay, so just ease that back down. Next thing to palpate, infraspinatus. And that's slightly awkward to palpate because it sits in the middle facet of the greater tuberosity. And for that, if we could just bring the arm up in front, and then gently externally rotate it, and then horizontally adduct it. And then I'm going to drop behind the posterior angle of the acromion process. Okay there? Yeah, a bit tender, is it alright?
It feels okay.
Okay, good. Drop that. So, this muscle also innervated by the suprascapular nerve, C5 and 6. Infraspinatus. How does that feel?
All right. Okay.
Okay. And then drop back down. Okay. Let's move on to active range of movement. Okay, Dan, so thank you for just letting me go over the rotator cuff palpation again, just because it didn't come out very well in the video. So if you could just gently bring that arm behind the back again. Okay, so with the arm straight behind the back, we just gently support it. Take an acromion grip, so finger and thumb around the posterior and anterior border of the acromion, and then just dropping off in front, we can feel the greater tuberosity, and between my index finger and middle finger is the tendon of supraspinatus, and that's a little bit uncomfortable. Okay, so just ease the arm back down, and the next thing to look at is the active range of movement.